Ladies and gentlemen, please welcome to the stage Eric Neetenbeen, President and CEO of Minnesota Masonic Charities.
Good afternoon. My name is Eric Neetenbeen, President and CEO of Minnesota Masonic Charities. My job today is to welcome you to this first ever Minnesota Cancer Moonshot. I stand here before you today as the lineal organizational descendant of a committee of 100 that was convened in January of 1955 by then Grandmaster Leroy Mattson, a justice of the Minnesota Supreme Court. Grandmaster Mattson had wondered about what the Masons and members of the Order of the Eastern Star of Minnesota might be able to do to ameliorate the suffering of those afflicted with cancer. In the mid-1950s, of course, the diagnosis of cancer was inevitably a death sentence. And at that time, back in 1955, the Masons of Minnesota decided that they would try and do something to help those victims of cancer. And so, in combination with the University of Minnesota, a decision was made to build the Masonic Memorial Hospital on the grounds of this campus. And that hospital came to fruition in 1958, and later it was added to. But again, still at that time, we were involved with trying to treat cancer and merely relieve suffering. We weren't at that point yet trying really seriously to cure it. Well, over the ensuing years, decisions were made organizationally to change the focus of what we, the Masons of Minnesota, were doing. And so gradually we did change our mission and moved along to finding cures and treatments for cancer. Just a few years ago, in 2008, we made a gift of $65 million to the university with the challenge that they find a cure for cancer within 15 years. We knew that that was a challenge which would be difficult to achieve, but nevertheless decided that it was appropriate to make that a serious part of our gift. Over the years, we will have provided $100 million for cancer research to the University of Minnesota. Now, while that's an impressive number, we know that the numbers involved are truly staggering and that the amount required is much more than we are able to provide. But we have long held the belief and the hope that through our gift we would entice others to be similarly generous and find ways where they could support cancer research, whether it be here at the University of Minnesota or other places. By the way, one of the stipulations in our gift was that any research that resulted in an improvement in the condition of cancer research, found new cures and treatments and so forth, would not be solely the property of the university, but it would be shared broadly so that everyone could benefit from the research being conducted here. It's indeed our privilege to be part of this magnificent partnership with the university and with the other cancer centers in the state of Minnesota as well. Mayo Clinic, the Hormel Institute are all part of this fight, and we are very pleased to join together with everyone. And now it's my pleasure to introduce to you Eric Kaler, President of the University of Minnesota. Thank you.
Thank you, Eric, and good afternoon, everyone. It's great to see one of my bosses here, Regent Dave McMillan. Also, welcome and hello to our medical school campus in Duluth, who's joining us on a simultaneous event And thank you to today's host organizations for our Minnesota Cancer Moonshot Summit, the Masonic Cancer Center and the University of Minnesota Health. And we're joined today by two of their leaders, Dr. Bobby Daniels, CEO of University of Minnesota Physicians and co-president of M Health, and representing the Masonic Cancer Center leadership, Dr. Edward Greeno, the medical director of the Masonic Cancer Clinic and Masonic Cancer Center Executive Committee. He's actually in the building, but he's in another room on a conference call with Vice President Joe Biden, the leader of the National Cancer Moonshot Initiative. But we thank Bobby and Ed for their leadership. Now, most of us are around the age when you think of moonshot as something from childhood days, but an example of when this country was able to strive for great and transformative goals. And today, as we lift off our very own Minnesota Cancer Moonshot Summit, we are in fact at an inflection point where I believe the science and the political will is ready for a renewed and concerted effort, as President Obama has said, to harness the spirit of American innovation. And I believe we can identify new ways to prevent, diagnose, and treat cancer. We here in Minnesota have of course, been leaders in cancer research innovation, from the lab to the operating room to the infusion clinic and to our policymakers. But we need a bigger push. For us to double the rate of progress against cancer, we will require the kind of cross-disciplinary, cross-industry, cross-institutional, and cross-cultural collaboration that we're seeing here today. And that's why I'm absolutely thrilled that this event has drawn all of you, the absolute right people from all disciplines, schools, and units of the university, from our academic health center to the Ornell Institute, and from so many of our regional health systems and partners. And then there are all of the advocacy and philanthropic organizations who've joined us, such as the Minnesota Cancer Alliance and Children's Cancer Research Funds, and of course our friends in state government and particularly in the legislature. I'm honored also that cancer survivors, cancer patients, and some of their family members and friends have joined us today also. You have stories to tell that truly motivate and drive our research. Together, there is a broad-based community focused on cure and care. Now, you may have noticed that one of our best-known leaders isn't here with us today. That's Dr. Douglas Yee, the director of our extraordinary Masonic Cancer Center. And Doug isn't here because he was invited to Washington, D.C. to join the nation's top cancer researchers and advocates at the national level summit with Vice President Biden. It's an honor that Doug is in D.C. with the Vice President because they are today at the epicenter of ideas that are designed and destined to change the national cancer conversation. And it reflects very well on the remarkable work that we do here that Doug is in D.C. We are a unified community determined to make history, and we can do that. Thank you. To tell us a little more about the Moonshot, let me turn over to Dr. Brooks Jackson, the leader of our Academic Health Center, the Vice President of Health Sciences, and the Dean of our medical school. Please welcome Dr. Jackson.
Thank you, President Kaler. I'm thrilled to see such a large and motivated crowd here today. President Kaler is right. This is the group that we need to make a difference in curing and treating cancer. Vice President Biden, after losing his son Beau to cancer in 2015, called for a moonshot to cure cancer. He was inspired by our country's motivation to race into space, our ability to dream big, after the Soviet Union's success with Sputnik. The term moonshot was also used in 1971 by President Nixon as he declared a war on cancer and signed the National Cancer Act of 1971. The legislation then strengthened the National Cancer Institute and brought new organization and funding to cancer research. At the State of the Union address this year, President Obama asked Vice President Biden to lead this new National Cancer Moonshot initiative. The goal of this initiative, this moonshot, is to seize the moment, accelerate our efforts to progress toward a cure, and to unleash new discoveries and breakthroughs. The science is here now. In Minnesota, recent advances in immunotherapy have been very exciting and have shown that we can activate the patient's own immune system against cancer cells with really dramatic success in melanoma, leukemia, and lymphoma. This breakthrough is ready for further exploration in a wider range of cancers. But it will take more investigators, more funds, more patients to enroll in clinical trials. Other researchers are looking at cancer from a different angle, finding ways to attack multiple pathways fundamental in cancer cell development by using combinations of therapeutic agents to stop cancer cell resistance. And when they find the combinations that stops this resistance in the laboratory, they'll need drug developers to make these agents into compounds that can be taken by people, and we'll need clinical collaborators for clinical trials. They also need funding to open and monitor these trials for safety and determine results. It is an expensive endeavor. Research into prevention is also critical. When carcinogenic compounds are identified in the laboratory and proven to be harmful to cell structures and DNA, investigators need partners in a number of areas: epidemiology, public health, advocacy, and philanthropy to turn that discovery into life-saving and life-changing information. Whether it is because for decades research has been done in silos based on sometimes disease type or a college or an institution, or because promising research was never translated for clinical use, or because we have too much bureaucracy or not enough funding, or for all the reasons above, it's time to acknowledge these changes. They have been substantial, and figure out how to overcome them. Cancer patients, advocates, legislators, researchers, survivors, funders, care providers, and community members are teaming up to figure out how to double the rate of progress in finding a cure for cancer. The goal is to take a decade's worth of work and do it in 5 years instead, making more therapies available to more patients while also improving our ability to prevent cancer and detect it at an earlier stage. Vice President Biden's Moonshot vision lays out a plan to increase the federal government's support of research. The Moonshot will drive progress through funding, targeted incentives, and increased private sector coordination. We need to be prepared to compete for this funding as an institution, and it will take all of us. The Vice President is calling upon research institutions to reach groundbreaking levels of learning about this terrible disease. On data and technology innovators to revolutionize how medical and research data are shared and used, or on the oncology care community to improve communication between doctors, patients, and researchers to provide the best care and the most options to patients, and upon the patient community to guide the conversation so that they and their families are treated as partners in care with access to their own data and the opportunity to contribute to research, and upon advocates and philanthropists to keep pushing us all forward with your passion and relentless commitment. Together with increased resources, we can and will make progress. Today, those of us assembled have answered the Vice President's call by convening the Minnesota Cancer Moonshot. And with that, it is now my honor to introduce you to Ruth Bachman, a patient and survivor, as well as an advocate and philanthropist. In addition to chairing the Masonic Cancer Center's Community Advisory Board, she has served as a member of the steering committee for the Minnesota Cancer Alliance since 2012 and is the Alliance's current secretary and treasurer. So thank you, Ruth, for everything you do. Please come on up.
Wow, this is a big day. I want to add my gratitude to all of you for being present today and for participating in this Moonshot event. So let's find out who's here. You know, in the cancer community, we're supposed to get physical activity whenever we can, so I would like you to stand as you are able if you happen to be a cancer survivor. Now you can stay standing and be joined by those who have been or are a caregiver. Stand, please, if you are a researcher. Stand, please, if you are a care provider in any role. And stand, please, if you are an advocate. And if we haven't achieved it already, let's get a standing ovation. Stand if you would like to see cancer eradicated. You can have a seat. More than most words, cancer has a particular meaning for just about everyone. My up-close and personal experience with cancer began in 1991 when I lost my younger sister, Kristen, to a reoccurrence of malignant melanoma that metastasized into her lungs and brain. She was only 35. And then in 2003, I had a soft, non-painful lump on the inside of my left wrist that I ignored for about 7 weeks, hoping that it would go away. I had the good fortune of going to see a young sports medicine specialist who happened to recognize the possibility of a problem and ordered an MRI. That MRI revealed a 6-inch mass beginning in my hand, filling my wrist and extending up my forearm. He paid attention to what was there and actually made an appointment for me with Dr. Dennis Cloesy, an orthopedic surgeon at the Masonic Cancer Center. Dr. Cloesy performed a biopsy and gave me my diagnosis of very high-grade malignant fibrous histiocytoma, the most common form of soft tissue sarcoma, which is a very uncommon form of cancer. Having been a left-handed woman for 54 years, I had grown rather attached to my hand. "Doctor," I asked, "what will happen if I don't accept amputation?" The answer shocked me. I was encouraged to choose life and choose something that was life-altering, disfiguring, potentially life-saving, but as is true with most things, there was no lifetime guarantee. I made my choice. I describe cancer as the narrow spot in an hourglass, and I'm the sand. I've traveled from the top to the bottom. My sand has been refined and redefined and certainly has a new arrangement, but it is the same sand. The Masonic Cancer Center, with its mission of advancing knowledge and enhancing care, is a remarkable place with remarkable people. I am living life, cancer-free and confident in the knowledge that I could not have received better care. Out of a desire to give back, I donate my time, my talent, and my resources on their behalf. I established the Hourglass Fund Project to express my gratitude for skillful, compassionate care delivered with remarkable competence found at the Masonic Cancer Center, and for the resources available to keep myself as emotionally and spiritually healthy at the same time and into the future, as represented by the Center for Spirituality and Healing, also at the University of Minnesota. So I established the Hourglass Fund at the University of Minnesota Foundation to foster collaboration of the science that heals the body with a critical role that mind and spirit play toward that end, and to support research at that intersection between the science of cancer and integrative health. In my advocacy role, it is my privilege to serve on the leadership team of the Minnesota Cancer Alliance, an extraordinary organization spurred on by the belief that many cancers can be prevented, and that many cancers can indeed be cured if members roll up their sleeves and work together. The Alliance is a voluntary coming together of organizations large and small, and individuals, many of them physicians, caregivers, and survivors like myself, who are committed to working together to reduce the burden of cancer across the continuum. 5 overarching goals guide our work. First, to prevent cancer from occurring. Second, to detect cancer in all of its myriad forms as early as possible when it is typically most treatable. Third, to treat all cancer patients with the most appropriate and effective therapy available. And that is where precision medicine and clinical trials come in. Fourth, to optimize the quality of life of all cancer patients and those who care and love them. And finally, to achieve health equity so that the disparities that we see in cancer data will disappear. This year, we have been working hard, hand in hand with the Minnesota's Cancer Control Program to revise the Minnesota Cancer Plan, developing something that is dynamic, flexible, and constructed to serve as a framework for action for the next decade. Many of the strategies that we discussed today hopefully will be found in that cancer plan. Today's agenda includes 3 panel discussions. The first focuses on cancer prevention. I have heard it said, they say, that 33% of all cancer would go away if we just stopped using tobacco, were physically active, maybe drank a little bit less alcohol, and watched what we ate. So we're going to be asking the questions. Why hasn't current research convinced people to do or not to do certain things? What research is up and coming? Why do policymakers, or what do policymakers need to do to work on it? The second panel will bring us the latest and greatest breakthroughs to prevent and treat cancer, including those, but not limited to chemotherapy and radiation, but instead to leverage viruses, the immune system, and even salmonella bacteria. The third panel is on clinical trials and patient advocacy. What can we do to change the public's opinion about not only wanting to, but finding the value in participating in research? What are the challenges of privacy when we look at big data sets? How do we double the rate of progress toward cure if trials are so specific that many people don't qualify for them? Panelists will each have a few minutes in order to address the topic, and then we'll have some real dialogue guided by the panel moderators, Dr. Dorothy Hatsukami, Jeffrey Miller, and Edward Greeno. We'll have microphones, so please speak up and love that microphone. And I challenge you to listen with 2 questions in mind. How can patient advocacy groups and the 15.5 million cancer survivors in the country today have their voices heard to bring about the solutions to the real problems that we will hear about? How can the organizations engaged in all aspects of healthcare address these issues as well? I'd like to welcome to the stage our first panelists with their moderator, Dr. Dorothy Hatsukami.